Hi, my name is Zaria and I want to talk to you today about the importance of understanding mental illness. When we think of mental illness, we always think of scary movies where the bad guy escapes out of a sane asylum and tries to kill everyone in town. That's not the case at all. People with mental illness are just like us, except their brain just works slightly different from people who do not have depression, anxiety, or schizophrenia, which is the main topic I will be talking to you today about. To get started, there is no known reason as to what causes schizophrenia. Being that symptoms are unique to humans and can't really be noticed in test subjects like animals, no one can really give a definitive answer as to what causes it. A clue that helps us to better understand what happens in the brain is that the majority of the medication that helps improve schizophrenia symptoms block the dopamine receptor D2, which reduces the dopamine levels in neurons, which suggests that schizophrenia has something to do with increased levels of dopamine released in the body. These medications do not work for everyone universally, so there isn't a medication that can help treat everyone. And like if you had as if you had a common cold, because schizophrenia is very broad and it's different for everyone, which means people will need a different cocktail of medications to keep them stable instead of using just one pill to take care of everything. Being that schizophrenia is so broad and it's not the same for each person, it can be kind of hard to diagnose or give the right medications or sometimes the right dose for people. Schizophrenia is actually a syndrome. There can be a lot of different symptoms that can be associated with it, and different patients might experience different symptoms. There are multiple symptoms that fall under three main categories, which are positive, negative, and cognitive. The positive symptoms, they are not symptoms in which they can help someone, but they help them to counteract their negative symptoms. These symptoms may be delusions, hallucinations, disorganized speech, disorganized behavior, and catatonic behavior. Negative symptoms are like a reduction or removal of normal processes, such as lack of emotions or loss of interest. This is called the flat effect, where they don't respond with emotions that seem appropriate for the situation, such as if something caught on fire, their reaction would be bland and not as if something is caught on fire, and they wouldn't have the same reaction as to someone who fully understands that something is on fire and is trying to put it out. Another symptom would be alogia, or lack of speech. So if someone asks them a basic question such as, are you in school? They'll just say yes or no and not say what school that they go to. They also lose lose motivation or confidence to complete certain tasks or meet certain goals because they lost all motivation to focus and complete a task at hand. The last category is cognitive, and when they are in this stage, they lose the ability to remember certain things such as their phone number, passwords, or their keys, or sometimes um, both at the same time. People with schizophrenia may cycle through these three phases where they're withdrawn, then they have symptoms of delusions or hallucinations, in the active phase, then the cognitive where they can't remember anything. And to show you a video, I will show you a video to help you understand more about this illness.
Schizophrenia affects how you think, feel, and behave. It affects around 1 in every 100 people. Schizophrenia has many symptoms, and you probably won't experience them all. Their symptoms lots of people have mildly or occasionally, but with schizophrenia, they're much more distressing. A hallucination happens when you hear, smell, feel, or see something that isn't really there. The most common type is hearing voices. These are usually rude, critical, or just plain irritating. A delusion is where you're completely sure of something which others see as mistaken or strange. Paranoid delusions are upsetting ideas that make you feel persecuted or harassed. You might start to see special meanings in ordinary events. It feels like things are specially connected to you, or that someone is communicating with you in strange ways. You can feel that your thoughts aren't your own, or that your body's being taken over. You lose interest in life. Your energy and emotions just drain away. You can struggle to concentrate and lose your normal thoughts, feelings, and motivations. You can also feel uncomfortable with other people. If you're starting to get these symptoms, you should talk to your doctor and start medication as soon as possible. Medication can help the most disturbing symptoms. Most people get support from a community mental health team. This includes a psychiatrist who organises your medication and takes responsibility for your overall care, and a care coordinator who helps you make a care plan and ensures you get the right support. Support from friends and family, counselling and other services are also very important. People with schizophrenia can feel suicidal, particularly if they're not getting the right support. That's why it's really important to ask for help. Learn to recognise early signs that you're becoming unwell. Agree with someone you trust that they can tell you if you're becoming unwell again. Try to avoid things that make you worse, like arguments, stress, street drugs, or drinking too much alcohol. Learn ways to relax. Make sure you regularly do something you enjoy. Look after yourself by eating a healthy diet with lots of fresh fruit and vegetables. Get some regular exercise, even if it's just a short walk each day. So, what does the future hold for someone with schizophrenia? Well, 1 in 5 people will recover completely. Most will get better, but have times when they get worse again. Many settle down, work, have good relationships, and live full lives. To find out more about schizophrenia, visit the Royal College of Psychiatrists website.
Alright guys, I hope you learned a lot from that video, such as I have. And in conclusion, schizophrenia is a bimental disorder that can affect children and adults differently in many ways, but that doesn't mean we have to treat them any differently. And I chose to highlight the signs and symptoms so you guys can get a better understanding of what it's like for someone with a mental disorder, and try to put yourself in their shoes and emphasize instead of judging them for something they can't control. Alright guys, that is my speech. Thank you for listening.